UPMC Eye Center is the latest iteration of what started out as the Eye and Ear Hospital here in Pittsburgh. That started in 1895. Over the years, that Eye and Ear Hospital has kind of morphed into what we now know as UPMC Eye Center and also the Department of Otolaryngology here at the Eye and Ear Institute. And so there's an academic department of ophthalmology, and we do patient care, but we also do research. And that research is focused on ways to cure eye diseases and to develop a better understanding of how those eye diseases work. What's the basic essence of why the eye isn't functioning properly, and even more, how the eye does function properly, down at the molecular level.
In terms of retinal blindness or corneal blindness or blindness from glaucoma, I mean, we have the infrastructure in place where these questions could really be answered.
Our patients are really incredibly important to us, both in terms of just providing their care, but also in terms of giving us a sense of what it is that we need to be fighting.
I have a rare disease that it was originally thought to be glaucoma, but it just kept getting worse, so they sent me here after I dealt with another doctor for about 2 years. I don't have attacks anymore. I'm only on 1 pill a day for the disease, and I'm on a drop, and I'm living life again, basically.
When you come into the center, even if you don't know what's wrong with you, if you just have blurry vision, again, you start with one provider, one physician, and again, if that is not the problem that provider can address, then you'll immediately get transferred to the correct surgeon or the correct physician that can help you.
One advantage of Pittsburgh is the close interactions between the clinical people and the research people. We're all in the same building. The research are on the 9 and 10, clinical are on 6, 7, and 8. And there is really an excellent collaboration and rapport between the clinical and the basic researchers.
I had concern about using a specific chemical for one of these techniques, and I was concerned a lot of other people use it across all over the world, actually, not just across the nation. But I was concerned. I went upstairs, 3 floors up, and talked to the researchers.
We've now published a couple of papers on it, and she was right. The things that some surgeons were doing in refractive surgery were dangerous to the eye, and now the practices are starting to change.
We try to really think about what we're doing and why we're doing it to optimize patient care.
It's absolutely critical that every physician needs to understand how research is done so that they can apply research to their clinical work.
The goal is to create better ophthalmologists, guys that will come along with better ideas or brand new ideas, or look at a problem in some aspect that we've never looked at before.
Our residents on a regular basis go out to foreign countries in order to provide care. We send them to Honduras once a year. We have a Mexico trip planned. They've been to India, they've been to Tajikistan. It's really exciting to help them provide care to deserving people in other countries. There are a lot of people right here in Western Pennsylvania who don't get what we would consider standard of care eye care. So we've formed something we call the Guerrilla Eye Service. We're actually on site doing complete front to back eye exams. We diagnose in the field, and when necessary, we try and treat them on site.
People can walk around with a lot of damage in their eyes, not knowing that they could have a problem with their vision. And then by the time they start losing vision and they come in to see us, then it's almost too late. We can do things, but we may not be able to restore vision that they've lost. So our goal is to prevent losing vision with laser before people actually come in with late-stage disease. So how do we do that? How do you find people who are at risk for losing vision but have no symptoms? Part of it's education, and part of it is through a program that we're developing called teleophthalmology.
Anywhere there's a camera at the other end, with the use of our electronic health system, we can integrate that and get the information transferred back, almost real time.
The UPMC Eye Center is really at the cutting edge of research, of clinical care.
We perform canaloplasty, trabectome, some of these other stenting devices that are relatively novel, but we've become expert in these. We have a critical mass of skilled individuals who can take care of these problem patients right here locally, but other places don't have this available to them. So it really can make a difference in facilitating their care. In my subspecialty, glaucoma, Dr. Schumann's brought along his OCT technology, which he helped co-develop.
By using OCT, we can measure very precisely the retina and identify types of diseases in the retina and also follow them over time. So OCT lets us make a three-dimensional map of the back of the eye, and it helps to guide our treatment of patients. It also helps us in diagnosing the presence of disease.
The optical coherence tomography device itself allows us to non-invasively image the human eye or an animal eye in vivo. When a disease is in the picture, this means that we're able to monitor the structural changes within the retina because of the disease. What we're learning from mice may teach us something about human disorders.
Let me give you an example for herpes zoster. Zoster, or shingles, causes pain in about a third of patients, and for about half of that third, there is really no treatment. There's no way that we can actually stop a lot of the pain that is induced. And so what we've got is a model that we can test and evaluate new treatments to try and block the pain.
This is the Charles T. Campbell Ophthalmic Microbiology Laboratory. We're a very unique laboratory. It's a fully certified laboratory to diagnose ocular infections. This may be the only laboratory in the United States that's totally independent. The goal of this laboratory is basically in three areas. Number one, it's a diagnostic laboratory. Number two, it instructs residents or young doctors to be aware of all the eye infections, and also it's a research laboratory in which we're trying to find out new techniques to discover new antibiotics and new treatments for infections.
We started a center for vision restoration, and that's called the Louis J. Fox Center for Vision Restoration. And that center is focused specifically on restoring vision and doing that in a couple of different ways.
We established a collaboration with Carnegie Mellon University, and the goal of the project is to try to incorporate machine vision algorithms into artificial vision device. We would use the BrainPort as a way to beta test that, since the BrainPort is something that is completely non-invasive. Let me show you how it works. The first part is a pair of standard Oakley sunglasses. Onto the front is mounted a small camera. This is what captures the visual scene for the patient. That visual scene from the camera is transmitted onto this apparatus, which we call the lollipop, but it's basically an intraoral display that takes the image from the camera and projects it onto the tongue. And then the final part is a handheld controller, and the handheld controller allows you to vary things like the intensity of the stimulation that you're getting.
Most of my career I've been thinking about corneal scars and how they prevent people from seeing, and this is actually a serious problem. There's 40 or 50,000 corneal transplants in the U.S. every year because once your cornea becomes cloudy from scarring, it doesn't get better. And stem cells can actually regenerate the original tissue, not just repair it. And so we had this idea that, first of all, we might be able to use the stem cells to grow a cornea in culture so we could transplant it. But then the idea came along that maybe we could actually do stem cell-based therapy, put the stem cells directly into the cornea and have it remodel the tissue, regenerate the tissue, and actually generate a clear cornea without having to do the transplant. So we tried this in a mouse model, and we were astounded to find that this tissue, which most of us consider sort of set in stone, like concrete's never going to change, the stem cells went in there and they made these cloudy corneas transparent in the mice.
I came here, I guess 12 years ago now, and took over the research program. And the reason I came here, the reason I liked the position here, was that the University of Pittsburgh is supported by an Eye and Ear Foundation, which is really unique. There are very few departments of ophthalmology that have the support of a group like the Eye and Ear Foundation of Pittsburgh. They provide ancillary support for our research efforts, and it's been a very useful thing. It allows us to recruit faculty It allows us to cover grants if there's a break in the funding.
We have collaborations with Carnegie Mellon University, with Intel, with the RAND Corporation, and all of that is right here in Pittsburgh. That's not counting all of the collaborations outside of Pittsburgh. It's such a fertile environment, and people really look at ways to help each other as opposed to ways that they can silo and keep their work only to themselves.
This department is really supportive of clinicians doing research. So unlike some of the other places that I've worked, we're given time to explore some research opportunities and let them grow.
UPMC has made a large investment in growing the eye center. And so it was seen as mission critical for the Department of Ophthalmology to grow and to be one of the greatest in the country.
It's your eyesight that you're dealing with, and I just think right now that I'm in the right place.
Our vision is to one day have a world without eye disease.